Hello everyone, my name is Nuria. I am also a third year medic at Exeter University, and I'm going to be talking to you about nutrition and health. So keeping your mind and your body healthy. First of all, congratulations on starting your course. It's such an interesting and rewarding course, and it will definitely keep you busy throughout the year. Like Amy and Emily have said, you will that there is a lot of content, you will have a lot of information to learn, but hopefully the tips and tricks that we give you today will help you throughout the year and also throughout the rest of your medical career. This year is likely to be a little bit different. Obviously, we've got COVID-19. So in terms of going out and socialising a lot at the beginning of the year, that will be a little different this year. But we wanted to give you some tips to maintain your health and well-being during what will be an odd year for all of us. Of course, keeping your mind and your body healthy do go hand in hand, as I will talk about in a bit, but I'm going to talk about nutrition, physical activity and mental well-being separately, and just give you a few suggestions because we're all individual and different things work for different people. So first of all, physical activity. Like I said, different things work for different people. Physical activity does not have to mean playing sport, going to the gym, running. It can just be going for a walk, whether as a revision break or just for some fresh air, and it can be really beneficial to get your body moving. There's a reason why I chose the words physical activity rather than exercise. I think the word exercise often has connotations with sort of doing a really intense workout. And the point I want to make here is if that's what you enjoy, then that's perfectly fine. And you can do that to stay healthy and get a rush of endorphins. But you can also just go for a leisurely walk with friends, and you're getting your body moving, you're getting some fresh air, and that can really help your body and your mind. Also, many universities will offer sports that you can do. Now you can, if you have a particular preference for sport, whether it be hockey, football, netball, rugby, you can train with the university several times a week. But if you want something that's a little bit more chilled out, especially because in medicine you can have more contact hours, then intramural sports are a great way to get some exercise in and also get to know people on your course. I personally did it in my first year of medicine. I played with the Medics netball team, and it was just such a lovely way to socialise with people, and also we only trained once a week, so it was very easy to fit within my schedule. Another top tip for you: Borrow My Doggy is an amazing app. I actually this morning went and took a dog out for a walk by the beach. Basically, you sign up for the app and you pay a small fee. I think it's something like £12, and that covers your insurance if anything, hopefully it won't, but if anything does go wrong. And then you can search through dog profiles and you can contact the owners and ask to take their dog for a walk. One of my housemates is doing it every Saturday morning, and she was saying this morning that it really gives her a reason to get up on a Saturday morning, and it's so good for her because she goes out and she gets some fresh air, and she also gets some miles of walking in as well. So that's something that I think, if you can, would be it'd be a really great way to get out and to walk, especially if, like me, while you're at uni, you miss your dog at home. So next I'm going to talk about nutrition. Now this is something that has always interested me personally, but quite often in first year nutrition isn't at the forefront of students' minds. The first few months you'll most likely be juggling finances, your lectures and spending time with new people, and that is completely fine. At the end of the day, what's most important is that when you're settling into university, you feel comfortable and you feel happy in your environment. Once you've settled in, you might want to start thinking, I mean, certainly when I was starting university, many people, especially when their student loans were coming in, were getting sort of takeaways and Dominoes. But after a while, when budgets start getting a little tighter, I've listed some tips here for for cooking during first year, and I've also continued to use course. So when you're cooking, you could cook double and then have some for lunch the next day. You could also meal prep. This is very useful for saving time and money, and something I often implement when I have a very busy revision schedule. I know it saved me a lot of time last year. What I mean by meal prep is, for example, on a Sunday afternoon, you could make, so I used to make peanut butter noodles or a stir fry, and I would make enough for about 4 portions, and I'd put them in the fridge and have them throughout the week. And I could just throw it in the microwave and it would be ready in 2 minutes. You can also make classic meals like your spag bowl, your chili con carne, or a curry, higher in fibre and vitamins and minerals by just adding a variety of veggies. So, for example, one of my flatmates in first year, when he made his bolognese, just used to put a can of tomatoes and, I don't know, a couple of carrots, and that was completely fine. But he was asking me how he could get more veg into his diet, and I said, well, why don't you add a few peppers or a few peas, whatever you have in the fridge, really, just to bulk it up a bit and also get those extra vitamins in. So he ended up doing that, and he thought it was actually quite tasty. So that's a little tip for you. And also, if your budget doesn't stretch to buying fresh veg, frozen veg is just as good, and it's often so much cheaper. I know I always buy frozen peas and frozen sweet corn for that reason. Also, great websites for recipes include BBC Good Food, that's a really good website, Bosch, and the Student Food Project, which I only found recently. And there are some really nice looking recipes on there, and they also make recipes specifically that are cheaper to make, because they appreciate students won't have a huge amount of money. Taking care of your mind. So I really wanted to talk about this last because it does encompass physical activity and nutrition as well. They definitely go hand in hand. And I last year did a little presentation for a group in uni on coping strategies. So I've basically taken a slide from the presentation I did last year and just wanted to talk through it a bit with you guys. So first of all, what can we do to cope with the environment in medicine? Don't get me wrong, it's an amazing course, but sometimes the workload can be just a little bit overwhelming. So what can we do? First of all, getting a support network around you is really important. I was once speaking to a foundation doctor, and I said, what is your biggest tip for someone starting medicine? And she said, make sure you've got a support network and really establish it early on, and they will help you so much throughout medical school. Don't be afraid to talk to people if you are finding something quite overwhelming. I think definitely a couple of weeks into uni when I started, I was thinking, gosh, this is a lot of work. I'm not sure how I'm going to learn everything. And a few weeks after that, I was actually talking with a friend, and she said, goodness, you wouldn't believe how many people I've talked to who said exactly the same thing. And next, make sure you have a social and a personal life. Like Emily said, it's important to do things outside of medicine and outside of studying, and to take time for yourself. When I was researching for this presentation, I had a look at various studies. One study found that impaired social activity was linked to impaired psychological health. It's so important. So, and like Emily said, it's really easy to meet new people by joining societies, etc. Obviously, this year might be a little bit different, but I know a lot of societies are doing events online. So really get involved with them, and you might be able to meet some new people. Also, when I was looking into this, there was a difference between active and emotional coping strategies. So active coping strategies are problem solving, or reevaluating a situation if something doesn't quite go your way. Emotional coping strategies are becoming withdrawn from a situation, or just accepting something as your fault when it's not necessarily. And there was a study that found that emotional coping strategies predicted forthcoming mental health problems over active coping strategies. That's something slightly, it's a slight tangent to this presentation, but you can find lots of things on coping strategies online, both active and emotional, and I really recommend having a look, 'cause it's actually very interesting. Also, exercise or physical activity, one or the other. Just 1 hour of exercise a week can prevent 12% of future cases of depression. And when I read that, I just thought it was very interesting, but also I was quite surprised by that, the fact that it's just 1 hour. And that could be just 1 hour on a Saturday, and then just starting off with 1 hour on a Saturday, and then you could increase that throughout the week as well if you wanted to, if you enjoyed it. Sleep is, I think, so underrated. It's so important. Sleep can affect the foods that you choose, your mood throughout the day. This particular study that I have on this slide found a relationship between less sleep and significant negative mood change. The recommended, everyone's individual, but the recommended is around 8 or 9 hours a night. In university, sometimes, I know, speaking from personal experience, that can be quite difficult to get, especially if you have several deadlines or exams coming up, but really making an effort to get those hours in can make a big difference. Mindfulness as well. Oxford Mindfulness Centre in 2016 showed that patients who engaged in therapy were 23% less likely to suffer an episode of relapse. Now, this study focused specifically on patients with mental health problems, but mindfulness can actually be beneficial to many people. Even you don't have to be sat there for 30 minutes in the morning or in the evening. You can just do 5 minutes at the beginning of the day, and it just it's very relaxing and it recenters you. And I have some friends who do it, and it just really prepares them for the day. The SMILE trial is one of my favourite trials I've ever read about, actually. It was a randomised control trial, and it was published in 2017. It was quite a small study, but it's one of the first in this field. There were 56 participants that completed a 12-week trial. So they were split in half, and one group were given a Mediterranean-style diet. So lots of fruits and veggies, a couple of portions of fish a week, and then foods with a lot of good fats like avocado, nuts, seeds. And then there was a control group that went to a couple of talking sessions a week. Now, with the group that had the Mediterranean diet for 12 weeks, sorry, I need to make one thing clear here. All the participants had mental health diagnoses. I think the majority of them had a diagnosis of depression. Now, by the end of the 12-week trial, those who had been on the Mediterranean diet, there was a 32.2% remission. And those in the control group, there was an 8% remission. So, like I said, this is quite a small study, but it really, I think, demonstrates so clearly the impact that a good diet can have on mood. And then the last one I have listed here, micro stressors. So I found this one quite interesting. I listened to it on a podcast. I believe it was with Dr. Rangan Chatterjee. And he was talking about micro stressors in the morning when he wakes up. So, for example, you get up and there is something on the floor and you trip over it, and then you go down to the kitchen to make your breakfast and there's a cup that's been left out on the side, and it's something that you don't necessarily realize will annoy you. And he was saying that you can sort of spot these 6 or 7 micro stresses throughout the morning, and by the time you leave the house to go to work or to go to uni, you can just be in a bit of a bad mood. So he said things like preparing your clothes the night before, like Amy was saying, having a clean working environment and a tidy working environment. It can make a huge difference. And before that podcast, I hadn't actually realised how much of a difference that could make. So thank you so much for listening to us talk today. I really hope that's been helpful for you guys. Good luck with your course. Medicine is really amazing, and please subscribe to SDocs on YouTube and follow their Facebook page. They have some amazing resources. And if you have any questions, direct them to Amy. Her email is on the screen. Bye guys.